Surat, located at the bank of River Tapi and embracing the oldest municipality, Surat stands as one of the most ancient cities. Surat has favorable climatic condition for emergence of different vector and vector-borne diseases. From the year 1988, Vector-Borne Disease Control Department has started malaria control activities with few clerical staff, and with the expansion of city, SMC has strengthened that surveillance system. Now, SMC has a unique and vigorous house-to-house surveillance system to control vector-borne diseases. All these activities were being done manually in initial years, but time-consuming system caused delay in reports of positive cases. Hence, SMC has established digitalized surveillance system to reduce time lag and achieve desired goals. VBDC application is already been downloaded to tablet by department. Unique username and password is allotted to each worker for starting the application. Starting the application, taskbar shows different reports on homepage that need to be filled with the required data. TPM, time, place, movement. Details have already been filled by the department. PHW survey consists of TPM details, house details, survey options, fever survey, intra-domestic survey, house details, owner name, family members, contact number, and most importantly, tenement number. All these details need to be filled up, which is very useful for tracking down workers' activity. If any malaria suspect found, the detail menu will be opened, inquiring the details of patient's name, age, gender, contact number, etc. On completion of fever survey, intra-domestic surveillance will be started. Worker will survey the house for any breeding emergence in different water storage containers. If any breeding is found in particular house, the worker will take necessary action to treat the breeding with suitable insecticide. Completing the routine survey, all summary details get synchronized to the server by worker. This will generate reports of intra and slide collection on dashboard as well as on worker's own tablet. The department has developed a software VBDC dashboard to monitor all activities like intra-survey and fever survey. For passive surveillance, one offline software is also working named VBDC application, and this software is linked with online software VBDC dashboard to generate both active and passive surveillance details. Dashboard shows very minute details like official's name, active workers, house survey, total slide collection, total positive, passive slide collection, passive slide positive, etc. For particular zone, unit and date, slides will be received and issued to the lab technician for screening. After screening, slides result will be filled up by the technicians. Report of intra-domestic survey will be generated automatically. This will include total summary of breeding places with the details of various breeding and indices, which is very important for monitoring. The application is based on GPS system, hence the location, timing, and movement of particular worker is also being monitored. It is also important to locate clustering of breeding as well as area where malaria-positive cases are registered. Our officials monitor monthly parasite index, survey index chart, also can correlate malaria cases with temperature and humidity on daily basis so that no sudden outbreak will happen. Various reports which were prepared manually in previous years will be generated through this software in real time. Important indices which are important for malaria and dengue control will be monitored regularly, and software indicates high indices from affected area with notifications sent to concerned official for immediate further follow-up. If any fever case is found positive for malaria during lab diagnosis, system generates a notification and SMS will be sent to concerned officials to take necessary action in real time and also to the patient for their information. After implementation of digitalized surveillance system, drastic reduction in malaria cases is reported. We would like to share some of the vital aims to develop this system: up-to-date information about case and follow-up, up-to-date information about ongoing scenario, clustering of cases and breeding potential, instant notification, better recording and paperless reporting. Step towards malaria-free Surat by 2022.